Every month, millions of retirees across America open their Medicare statements and feel that same sinking feeling in their stomach. The numbers don't match what they expected, and sometimes the charges look almost impossible. If you're over 65, the truth is unsettling. In 2025, a hidden Medicare rule is quietly draining thousands of dollars from seniors' savings. It's perfectly legal, buried in fine print most people never read. And the worst part? Many only realize it when the bill lands in their mailbox. Too late to fight it. I'm Michael Turner, a retirement advisor with over 15 years of experience helping seniors protect their benefits and avoid costly mistakes. I've seen how this hidden Medicare trap catches even the most careful retirees. Today, I'll show you exactly how it works and the steps you can take right now to shut it down. Margaret, 72, from Florida, thought she was making a smart move. A friendly agent promised her better coverage and extra benefits if she switched Medicare plans. It sounded perfect. No extra monthly premium, free dental, and vision. But 3 months later, after a short hospital stay, she opened her mailbox to find a bill for $6,400. The coverage she thought she had wasn't there. And by then, she was locked into the plan for the rest of the year. Here's how the trap works. These plans hook seniors with tempting extras: free vision, dental, gym memberships, and the promise of no monthly premium. But buried in the fine print are higher out-of-pocket limits, strict rules on what's covered, and smaller doctor networks. It looks like a better deal until you actually need care. Then, the hidden costs appear, leaving you with bills you never budgeted for, and no easy way out until the enrollment window reopens. You've probably seen the commercials: get free vision, dental, and hearing aids, all with zero monthly premium. On the surface, it sounds like a dream for anyone living on a fixed income. Who wouldn't want extra benefits without paying more each month? But here's the catch. Those free perks are funded by cutting back in other areas, often the ones you actually need most. These plans can have higher copays for hospital stays, specialist visits, or outpatient treatments. And while they highlight zero premium, they quietly raise your maximum out-of-pocket limit, meaning you could be on the hook for thousands each year if you get sick. Take Tom, 68, from New Jersey. He signed up for one of these plans because it covered a new pair of glasses and routine dental checkups. It seemed like a smart choice. But when he needed cataract surgery, he discovered his copay was $450 per eye, plus an additional $900 in so-called facility fees. What he thought would be a no-cost procedure ended up costing him $1,800, far more than he ever saved on dental and vision combined. For someone on a fixed retirement budget, that kind of surprise bill isn't just inconvenient, it can throw off your entire year's finances. Before enrolling in any Medicare Advantage plan, always check the maximum out-of-pocket number. It's usually buried deep in the plan summary. If that number is over $5,000, you could face a financial shock in the middle of a health crisis. And remember, those extras aren't truly free. You're paying for them in other ways. Taking just a few minutes to compare the plan's out-of-pocket limit with original Medicare could be the difference between steady, predictable costs and a sudden bill that drains your savings. They promise your prescriptions are fully covered all year. But here's the loophole most people never hear about. Medicare Advantage plans can change their drug list, called a formulary, in the middle of the year. That means a medication you rely on today could be dropped tomorrow, forcing you to pay out of pocket or switch to a less effective alternative. Imagine this happening when you're managing a chronic condition. It's not just inconvenient, it can be dangerous. That's exactly what happened to Linda, 70, in Ohio. She was taking a brand-name heart medication that kept her stable for years. When she enrolled in a new plan, the drug was covered in January. But by July, she received a letter saying it was no longer on the approved list. Her out-of-pocket cost jumped to over $400 a month, money she didn't have in her budget. She spent weeks trying to appeal, but the process dragged on, and during that time, her health declined. The plan wasn't breaking the law. They're allowed to adjust their formulary mid-year, but it left her paying thousands more than she expected. If you're on any prescription, don't assume coverage will stay the same for the full year. Every January and July, recheck your plan's drug list. You can find it on your plan's website or by calling customer service. If a change affects you, ask your doctor immediately about alternatives and explore switching plans during a special enrollment period if you qualify. Staying ahead of these changes can save you hundreds, even thousands, and protect your health from sudden disruptions. One of the most common promises you'll hear is, "You can keep your doctor." It's reassuring, especially if you've been seeing the same physician for years. But with many Medicare Advantage plans, that promise can disappear without warning. These plans rely on provider networks, and those networks can shrink at any time. Your doctor may choose to leave, or the plan may drop them to cut costs. Either way, you're left scrambling to find a new provider, sometimes far from home. Bill, 74, from Texas, experienced this firsthand. He signed up for a plan that listed his trusted cardiologist in-network. For the first year, everything was fine, but in the second year, without any phone call or direct notice, his doctor's office was suddenly out of network. When Bill needed a routine checkup, he was told he'd either have to pay the full cost, over $300, or travel 60 miles to see a different cardiologist the plan would cover. For someone his age, that long drive wasn't just inconvenient, it was exhausting and risky. The truth is, network changes can happen at any point during the year, and plans are only required to give minimal notice, often buried in a letter that looks like junk mail. The solution? Every 3 to 6 months, call your main doctors and ask if they're still in your plan's network. Don't wait until you're standing at the front desk being told you're out of network. If you find out your provider is leaving, explore switching plans during a special enrollment period or ask about exceptions for ongoing treatment. Staying proactive means you won't lose access to the care and the relationships that keep you healthy. It often starts with a phone call. A friendly voice tells you there's a special enrollment about to end, and if you don't act now, you'll miss out on extra benefits. They make it sound urgent, even personal, as if they're calling just to help you. But here's what's really going on. Many of these callers work for third-party marketing companies that earn commissions when you switch plans, and the plans that pay them the highest commissions aren't necessarily the ones that are best for you. Helen, 69, from Arizona, learned this the hard way. She got a call one afternoon from someone who claimed to be working with Medicare, which sounded official. They offered her lower co-pays and a free fitness membership if she switched before the deadline. Feeling pressured and caught off guard, she agreed over the phone. What she didn't realize was that her new plan had a narrower hospital network. 2 months later, when she needed surgery, she discovered her local hospital was no longer covered. She had to drive to another city and faced unexpected travel and lodging expenses on top of her medical costs. The truth? Medicare will never call you out of the blue to switch your plan. Those calls are sales pitches, and the urgency is designed to rush you into a decision without reviewing the details. If you get one, hang up and contact Medicare directly at 1-800-MEDICARE or visit Medicare.gov. Any real plan changes should be made through official channels, never through a stranger on the phone. The best defense is to slow down, ask questions, and verify everything before you sign or agree to anything. A 5-minute pause today could save you thousands and protect your healthcare access tomorrow. If you find yourself stuck in a bad Medicare plan, you might think you have no choice but to wait until the next open enrollment. But here's a little-known rule. In certain situations, you have only 60 days in a special enrollment period to escape and switch to a better plan. Miss that window, and you're locked in for the rest of the year, no matter how high your bills get. Many seniors don't even know they qualify until it's too late. Mark that 60-day deadline on your calendar the moment you realize your plan isn't working for you. Acting quickly could save you thousands and restore access to the care you actually need. Here's how to lock in your protection and avoid every trap we've covered. First, check your drug list twice a year, in January and July, to catch any mid-year changes. Second, verify your doctors are still in network every 3 to 6 months. Third, review your plan's maximum out-of-pocket limit before enrolling, and never switch plans over the phone. Finally, remember that 60-day special enrollment period. It's your escape hatch if things go wrong. Do these 4 things together, and you're building a shield around your retirement savings and your health. It's not complicated, but it works, and it can save you tens of thousands over the years. Let's quickly recap the key steps you can take right now to protect yourself from this hidden Medicare scam. 1. Never be swayed by free benefits without checking the true costs hidden in the fine print. 2. Review your drug list in January and July to prevent sudden, expensive surprises. 3. Confirm your doctors are still in network every few months so you don't lose access when you need them most. 4. Never agree to switch plans over the phone. Use official Medicare channels only. 5. Remember the 60-day special enrollment period as your lifeline if you need to get out of a bad plan. These are simple actions, but together, they can protect your savings, your health, and your peace of mind. Because Medicare isn't just about coverage, it's about your ability to live freely, without fear of the next medical bill wiping out your hard-earned retirement. You've worked decades for this security. Don't let fine print or fast-talking salespeople take it away. Your future, your family, and your freedom are worth defending.